colleagues for the last several years, since BudgIT has been a partner for many years of global integrity. And in addition, BudgIT runs Civic Hive, which is the affiliate hub of Lagos, Nigeria, who's part of the Open Hub's Global Hubs Network. So there's just kind of lots of connections today that we're really excited to explore. And as you said, we will hear from some of the partners in some of the 7 other African countries who are involved with the CTAP work. But I'd love to just ask you follow-up for now, Iyanu, which is, we're talking about such a massive amount of resources and such a massive amount of data. So what has been some of the most interesting surprises and findings for you so far, if we are trying to answer the question, how well are governments managing the resources and how much resources are actually going to waste?
Okay, so I would use Nigeria as an example, right? We had billions of naira coming to the country, and what we discovered with we have a platform which the government launched back in 2018, which is the open platform, right? Which is what gives you the opportunity to understand what government is spending at each particular point. So, in the advent of COVID, there was emergency procurement that needed to be done, right? And we saw the figures, right? We saw what was spent on what, and after analyzing these figures, we realized that some of the expenses made were not correlating with what we saw on the ground, because we also deployed ourselves to field to see, okay, if you said you bought so and so stocks, where are they, right? We realized that some of the projects doesn't even have contractors. Some of the projects don't even have a detailed description of what the money was spent on, right? We also realized that some of the ministries, right, they just pack the money and give it to just the same contractor to keep almost everything, right? And it begs the question to ask, is that the only person that understands the assignment? And so all of these funds that came in, so some of the resources, I would say some of them were used rightly, but analyzing some of them, we realized that they were, just superior waste, right? And how we locally say, COVID needed a lot of millionaires, right? Because at the end of the day, the normal procurement process was not followed, right? Because it's an emergency. So there's a different framework to procure items and equipment during health emergency crisis like this. And because it was a novel virus, nobody knew where it was going. Nobody knew how it was going to end, right? But what we also did was for us was to say we are monitoring this influence, right? And at the start, it was difficult to say this is amount of accountability you're going to see, because what we also did was we created different platforms even before the CTAP platform, right? To monitor the flow so that we keep tabs, because not all the states across the country were ready to put out information as to how much we're getting. We're not also ready to also put out information even as to how much we spent. And we also realized that a lot of states made adjustments to their budget, which is they call the COVID budget, which is the main supplementary budget to what they plan to spend before the whole pandemic kicked in, right? So yes, so for us, interesting things we also see was part of the palliatives that were highlighted to be given to people were spent by some individuals, right? Some individuals were using the palliatives for political self-organization. Some of them were using to celebrate birthdays. And across the country, we saw the warehouses that belonged to the government, which were locked under lock and key, and the foods were getting stopped, right? The food that was supposed to be shared, and there was so much gory pictures. And if you check, there's so much gory pictures online where people were stepping on each other to access this palliative. So yes, so there were a lot of all of these things that were there, and there were issues that we brought to the table as to say, how can we make these things better, right? And some of the feedback we got was the middleman with the problem, right? We've brought out the resources for people to use, but we cannot monitor from end to end, right? So, and that was where we came in to say, okay, there's a fault in the process, and these are the things we believe you should do to make these processes easier and also, effective to get the results which you were looking for. And yes, we were able to do that, and we go to the private donators, we go to the government donators, and we were able to get feedback from some of them to say we're going to improve this this process. And we also got feedback that really didn't go down well with us, but just know that we continuously speak and ask questions because that's the only way we can get the response that we want.
Yeah.
Thank you very much.
Awesome. Thank you, Iyanuoluwa. Yeah, you've uncovered so much for the rest of our discussion. First of all, talking about the reality that these resources are coming from so many different places, maybe from the World Bank, from the African Development Bank, from bilateral donors. And so, it makes it more complex to track, but very important. And of course, the pressures on the contracting and procurement process when you are in a state of emergency, the standards can drop very easily. So on that note, I would love to bring in Andie, who's one of our discussants from the Open Contracting Partnership, to build on what we've already heard from Iyanuoluwa and share a little bit more about what you're seeing and learning with regards to open data portals. How are they a useful tool to do some of this monitoring work? And maybe what are some of the challenges as well?
All right, thank you so much for this speaking opportunity. And I'm just going to touch lightly on some of the findings that we've seen or some of the activities we've seen within the space since COVID-19. And I'll use the example of Nigeria and another country, Moldova, though it's not an African country, because of how they've seen results in their monitoring tool. So Nigeria, like Iyanuoluwa mentioned, has NOCOPO, the Nigerian Open Contracting Government Portal, and that was launched and prior to it being used to track COVID-19 spending, BPP they were proactive enough to have published emergency procurement guidelines. So by July 2020, we saw 5 MDAs publishing on that platform, though that is a paltry number or a very minuscule amount, given that there are over 150 MDAs in Nigeria, well over 150. But with just that little information, we saw organizations like BudgIT, DataFight, Connected Development, PPDC, through their Budeshi platform, taking that data and utilizing it into storytelling. And by November, that number had increased to about 9 MDAs also publishing data. And so what we saw was that that COVID actually inadvertently strengthened organizations working for greater transparency and accountability. And one of the things that we've seen that has proven very valuable when developing your monitoring tool is not to just solely position yourself as a watchdog, but even think collaboratively in working with the government in the development of those tools. And that's why I wanted to use the example of Moldova, an organization called Positive Initiative in Moldova, who was supported on our Lift Open Contracting Program. They were able to develop and build a public platform that displays detailed information about all the government's contracts for suppliers and services to fight COVID-19. One of the key things that they did was that they were able to push for the government to move from publishing any health procurement whatsoever onto this platform instead of publishing it on the general government platform, mTender. So all healthcare procurement in Moldova was temporarily excluded, not permanently, from the laws governing procurement and were no longer recorded on the government's official database. So basically, the public platform that was developed between Positive Initiative and the government now became the place to source for COVID-19 data and healthcare procurement spending. So I would say that thinking about your monitoring tools and procurement tools, one thing that's very useful is that it's important to ensure that if you have full information on these platforms. That's when it will prove to be useful. And something that's very valuable when you're thinking about your procurement tools, the opportunity it offers is that it helps you create clear feedback channels and spaces for meaningful participation. So not just from the typical civil society and government, you can hear directly from citizens through these tools. And so we encourage people to think about innovative partnerships with private sector and with civil society. So we want the government to be able to see civil society as a valuable ally and analyst in tracking the preparedness and ensuring resources are allocated efficiently, so that the government is also not responding just reactively, but the government is proactive in their COVID-19 response. That's the value in working collaboratively with civil society. The other thing is that civil society can fill that gap where there's a lack of technical capacity in the government space, and that's how you can push towards a very useful and robust procuring monitoring tool. And then something else that's valuable is that as you're communicating, as you're making all of these changes, it's important to obviously involve every other agency. So there should be some kind of cross-agency monitoring and coordination taking place. That's the opportunity monitoring tools offer when you're implementing them properly. And a good thing you can embed in your monitoring tool is also what we call the red flags methodology, to just identify gaps within your system. That's something that's very useful when implementing it. And most importantly, I think the biggest value I would say that a procurement monitoring tool around COVID-19 could really offer is that opportunity to simplify the language around procurement for citizens to easily understand and see and know what it is government is doing and providing for them in response to COVID-19 procurement and relief that they're providing to citizens. Then in terms of the challenges you tend to see is that when the most important thing is that the data should be there in the first place. So for you to have a useful monitoring tool, it has to be that government is already publishing some amount of its procurement data openly and publicly, and that it is reusable. And something else that's very valuable that maybe many governments might have overlooked in the past is the fact that you need to standardize that data. We obviously recommend our open contracting data standard. I very readily tout that all the time. But in addition to that, it's useful to have a marker in your line items, in the different procurement items that can specify COVID-19, so that if you're not using like the Moldova model where they moved all healthcare procurement to another system, if you're using your standard EGP systems or your standard open contracting data standard portal, you should be able to have that COVID-19 marker there to provide an additional distinction that this is procurement data, so that anybody coming onto your system can simply impute COVID-19 and then they can find out whatever data or whatever information is readily available there. And something else that might prove to be a challenge in some cases is getting that clear political buy-in, because like I mentioned, referring back to Nigeria, one of the things that even helped for people to start publishing in the first place was that they provided guidelines around emergency procurement. That was the first proactive step that was taken. So it's important to do that. And then also the government, something that will be useful for monitoring tools is if the government too can improve emergency procurement procedures and gradually shift away from non-competitive COVID-19 procurement through better planning.
Yeah, thank you so much, Andie. Again, so much good food for thought here. And like you said a minute ago, it's so simple, but making sure that procurement platforms have some kind of marker, label, some way to filter basically the COVID-19 response efforts is so important for people to then provide that oversight and support for pandemic response. I also really appreciate how many times we talk about citizens as the eyes and ears of government when we're talking about open government and reforms, but this is especially necessary if we're again dealing with an emergency response. Government will just not have the capacity to manage and track everything, so we need to step in. Thank you. This is excellent. So I'd love to turn now to Renzo from the Open Government Partnership to keep building on our conversation and specifically to speak more about the citizen engagement side of the equation. Many of us may have specialized knowledge as civil society groups to support tracking, but it's our job to also bring more citizens involved and empower them with storytelling about the role that they can play to monitor government performance in an emergency. Renzo, would love to hear your insights from the OGP.
Thanks, Netta, and thanks for having me. Love the hybrid event. I appreciate that you've put the effort into making it work. So from the Open Government Partnership, as many of you might already know, is a partnership of 78 countries, many local governments as well, and thousands of civil society organizations. And the idea of citizen participation is at the core of the OGP model. As citizens and governments are expected to work together to develop action plans, 2-year action plans with concrete actions and reforms to improve openness. And I'm specifically on the data and analysis team, and so we have all of these commitments come in and we investigate which commitments are trending in which topics where we don't see commitments. And so I wanted to mention specifically on this, the citizen participation related to the pandemic response. So in the past 2 years now, we have seen several OGP action plans come in with specific commitments related to open government through the pandemic. Within those action plans, most of the commitments have related to opening data around cases, hospitalizations, expenditures related to the pandemic. Very few have dealt with citizen engagement throughout the process. And this is very similar to what Andie was just mentioning, that it's obviously not just about the disclosure, it's about bringing people in the development of the strategies, of the tools for disclosing information. So I wanted to mention a few examples of commitments that we've seen. Of the few that we have seen, I wanted to mention a brief description. So specifically in Africa, we've seen Nigeria. They made a commitment in 2020 related to open contracting, specifically related to the pandemic, and to involving diversity of stakeholders through the process. And I can share more information in the chat on this commitment. We've also seen a great example from Liberia on training health professionals and community health workers at the local level to not only track information, but also to monitor. So to be engaged in that process of monitoring the right information, but also making sure that it's digestible for a broad audience at the local level. As Andie said as well, I think it's about finding the new forms of participation and collaboration. And as she did, I also wanted to mention a few examples from beyond the region of a few commitments that we've seen that are quite interesting and could be relevant broadly. So one was specifically from Colombia, where they have set up regular meetings with civil society organization to discuss expenditures related to the pandemic at the project level. And so what's, I think, more experimental about that approach is they're institutionalizing the communication with civil society throughout the pandemic. So instead of, here is all of the data we have on expenditures, here is a dashboard that visualizes it, it's actually regular meetings to discuss priorities, needs for more information, discussing what's already been published. So that seems like a really promising example. The other is from the Czech Republic, that I think is something we often overlook, how governments are communicating with civil society during the pandemic. Their commitment was to create a new methodology for public participation that includes rules for communication during emergency situations. And so I think as in many cases we saw contracting information, procurement be disclosed, and there are these new forms of disclosure, and it all happened very quickly. We kind of lost track of how our existing platform systems for consultation need to be adapted for the current situation. So I think that kind of institutionalization of engagement will be a really important area for reform. So as I said, we haven't seen too many commitments related to the topic through OGP, but these action plans are a really important way to move from discussion down to the country level action and co-creation of reforms, and having this kind of domestic implementation mechanism will be can be really useful. So I just wanted to mention that from the OGP side, and we can get into more specifics later if it's of interest. Thanks.
Thank you so much, Renzo. Yeah, really interesting. And one of the points I really appreciate is the example you gave about just kind of resetting standards regarding open government communication in a pandemic. Because again, we know government can't be perfect, especially in such a crisis, but the more open the communication, I think, the better. So now I'll give Iyanu a minute to see if you want to kind of respond to anything that you've heard from Renzo and from Andie. And then after that, we're going to do, again, a very rapid fire knowledge cafe with 4 additional CTAP partners in other countries. So yeah, Iyanu, any quick comments on the open data or citizen engagement?
Yeah, so for us, we also launched a platform called the Blockchain last year. And the idea is just to also pick up data from the national open platform, where we are also able to analyze all the spendings and also that in real time, we see certain points, and how much money is going in the particular project. And for us, although we have some challenges, which is also part of Renzo's talk about ground data, which is sometimes you have challenges from the government, pulling out the data as much as you want, right? So it becomes seasonal, and that also does not allow you to do more as towards advocacy as you are going to do. And for the OGP, part of the plans for CTAP 2 is to also, across all the 9 countries now, for the ones that have OGP commitment in their countries, we're trying to also see how we can improve the framework for health investment in these countries. And also for the ones that do not have OGP, we're trying to see how we can raise civil society and also people who are stakeholders who are also be like a pressure group to also see how health investment can go up in this country. And to cap it off, the African Union in 2001 had a meeting in Abuja where there's a particular percentage of the budget that is going to health investment, which is like the 15% of the budget. This is going to health investment. Nigeria has been falling behind. Rwanda and South Africa are doing very well in that aspect, but we are trying to see how we can encourage more African countries to do more investment into health, because that's like the overall beauty of their own country as a whole, and see how citizens can be better, and we can have through that have more productivity in each of our countries.
Yeah, thank you so much. That's a great point too, because so many of our countries have made regional or international commitments, like you said, spend 15% of budget on healthcare and so on. But they often need some reminders to follow through on that. So the more we can build the healthcare system, obviously, the better prepared for any future crisis. Fantastic. So we will move now into, again, just a really rapid fire knowledge cafe, as we call it, which means to hear from 4 CTAP colleagues in the virtual audience. Each, please share just 1 or 2 minutes reflection on how the pandemic recovery work is playing out in your country. So the first person we have is Busayo from Code, Follow the Money in Nigeria. Let's see if we can pull up Busayo, and then we'll hear from a few other partners as well. Again, just a 1 or 2 minute snapshot of what you're seeing and finding in this CTAP project.
So I have Busayo and I have Ray. I don't see Nancy right now.
Okay, yeah, so let me start with Busayo if possible, and I know we're coordinating across 2 different things, but we can do that. So please, go ahead.
I'm sure.
Yeah, can I go ahead, please?
Yeah, please. Thank you.
All right. Hey, hello guys. Great speaking to and listening to our thoughts. Thanks Iyanu for speaking for Nigeria. I also heard Andie also speak for Nigeria also. I think Iyanu has said a bunch of what I probably would come here to say. For us, COVID-19 gave us that unique opportunity to, number one, collaborate, come together as a bunch in the civil society space, connected development, budget, bringing in other guys also with us across, various countries. And one of the things we noticed was that even before the government came up with the emergency procurement guidelines, we had to have a conversation with the Bureau of Public Procurement, bringing in Budeshi, and bringing in other guys, PPDC, SERAP, and the likes. And we had a conversation with the BPP, and we're saying to them that, hey guys, as much as possible, we need you guys to give us that emergency procurement guideline, and good enough they did. But the challenges, the agreement was that immediately after the pandemic, or when cities began to open, the government were going to give us a list of the procurements, of all the procurements that happened within the period. This is 2 years since 2020. We're still waiting for that. So that means that government has not been able to do enough, to honor their part of the bargain. Another thing that happened was that we were able to get a whole lot of data around either budgeting or donations, but the kind of data we needed for us to be able to juxtapose what these funds were used for was the expense data, right? Till now, we do not still have the expense data, and it's interesting because we understand the kind of government we have in Nigeria, one that pays lip service to these issues, and wants to just do what they feel like doing. Just about few days ago, we just unraveled that tertiary institutions, for example, got about 950 million naira each, and about 52 of them got that fund. But the question is, when you go to the field, when our field monitors go to the field, we cannot see the commensurate value of 950,000 naira, 950 million naira, in those tertiary health centers. And these facilities, interestingly, are facilities in universities, and tertiary hospitals across the country, about 52 of them. And maybe lastly, I would just say that we took it upon ourselves to evaluate the ability of the Primary Healthcare Development Agency to, number one, store vaccines, number two, distribute those vaccines equitably, for that matter. And what we discovered from our work, with BudgIT and, Code and Global Integrity, was the fact that a chunk of those vaccines that got into the country, became just ordinary water, in those bottles when they got to their final destinations. And the reason why was because we couldn't fix logistics. We had issues with storing, ensuring that those vials were, at a certain temperature, which probably deepens the distrust between citizens and government. So a chunk of people that may have gotten vaccines in this country, Nigeria, are people who probably just got water injected into them and they felt, they got COVID vaccines. It's a very, very gory reality when you want to think about it. But for us, we're not stopping. Collaboration is still going on. Like Iyanu has said, CTAP phase 2, we're looking at vaccine equity. We're looking at a chunk of, how to be able to bridge the trust deficit, between government, and the citizens. And we're trying also to, and unfortunately also, Nigeria audits, our audit is still in 2019. So hopefully before we get to 2020, 2021, we should be talking about 2023, 2024. So it makes it even more difficult, for us to audit the government, as it were, unlike, Cameroon and Malawi, who even within those years, they were able to audit, and were able to bring to forward what happened, during COVID. So, I'm ending on this note, that we can do more. And one of the ways we can be able to do more is through active participation and collaboration. But much more than what we as the organized civil society will do is what citizens, the moment we mobilize citizens enough to begin to ask these questions, then we have to, we'll begin to see the real signs of that kind of change, driven by community and the people. Thank you very much.
Thank you so much, Masayo. Yeah, really excellent reminders of how much this influences trust in government. If you think you've gotten the vaccine and it's not a real vaccine, that's a real problem. So thank you so much. We're going to keep going, and please just everyone in the audience think about the questions you may have. We'll move to that in a few minutes. But next, I think I saw Nancy from Cameroon also in the CTAP network. Nancy, if you could just share 1 or 2 minutes, what are you seeing in Cameroon for this?
Feel free to be on camera. There we go.
Hello.
Hello.
Hi, good evening. It's evening here in Cameroon. I'm called Denance Saibu. I am the country lead for Follow the Money. I'm excited to be here to share our experience of CTAP Phase 1 in tracking government expenditure of COVID-19 funds. Like Busayo and Iyanu said, it's not different from Nigeria. In Cameroon, with the crisis, it's more complex and difficult to do the work. But we had some few success story in the sense that the Ministry of Justice could give us accreditations to have some information, and also we're able to advocate for government to audit the COVID-19 funds. So at some point, it was kind of very complex to go down to some regions of the country and meet some authorities to give us this information. And I can say in 3 regions where we track the state of public health services, it was difficult for us to get data because this local authorities will not speak. They're afraid to share the stories on the COVID funds or on the state of the primary healthcare services in this region. So it kind of made us we had to wait that they give us this information, because our work will be incomplete if they don't tell us exactly how, for example, in the east region of the country, they manage the COVID funds and how they manage the COVID in this country. So we in Cameroon, we held a series of coalition meetings where we invited the government institutions, we invited the anti-corruption institution, and some civil society organizations. But we were very surprised that some key ministries that are involved in the management of COVID funds could not show up to in this meeting. But we are not surprised. Anything that Cameroonians are new, and I don't want to use the word afraid, were to demand for accountability. So CTAP 1 was kind of mobilizing citizens to understand that it is our right. Okay, so we had this extra work we had to do in Cameroon to make sure that people understand that what we are doing is we are not fighting with the government, but we are trying to bring the citizens of Cameroon to understand that it's their right to demand for accountability in the management of COVID funds. And behold, when the audit was done, they shared the report, and there was a lot of mismanagement of funds. So we are asking, it's been 3 years since the final report of the management of COVID funds was released, but no sanction has been made, no action has been made. So CTAP 2 is an opportunity for us to keep on advocating, making sure that those who were involved in the mismanagement of funds are held to account. And also, we in Cameroon, some regions, we cannot access some regions presently, the Anglophone regions where we have the crisis, the Anglophone crisis, but there they had the COVID, and they also have the crisis, so making it 2 crises in this region. So we want to understand, so how has government been managing these 2 crises, and how are the citizens responsive? And we have a representative in this region that told us that at some point the AMBA, because they call them the terrorists, they call them the AMBA, had to stop them from going to some communities. And because we want to protect my member, I just ask them, sometimes you just have to stay and don't push further, because you're either going to be stopped by the government, the armed forces, or the government. So these are some of the challenges we faced during the CTAP 1, and we are looking forward to using the radio to communicate and advocate, because we are not going to rest if those who were involved in the mismanagement of these funds, of COVID funds, are not held to account or are not sanctioned. So CTAP 2 is an opportunity to continue advocating, making sure that those that were mentioned in this report in the mismanagement of these funds are held to account, and that government also understand that we, the civil society organization, are not fighting them, but we want them to show that they are transparent, and they want we as civil society organization want to work with them. So I hope I still respect my 1 minute. So it's an exciting journey for us at Follow the Money Cameroon to still be able to work and make sure that we hold our government to account when it comes to COVID and the healthcare facilities in Cameroon. Thank you.
Constance, we really appreciate it. I do want to make sure we can get to some questions, and that's why I'm looking at this. We have Ray from BudgIT in Ghana, and then Sharon from Malawi. Each, if you don't mind, just to keep it very brief, maybe 1 minute or 30 seconds, just a quick update to add to what we've already discussed. And then we will open for questions for the last 10 minutes of the event. So, Ray, if you are still online with us, please, just any additional perspectives you have from Ghana, and welcome.
Yeah, thank you for the opportunity to speak about the response to COVID in Ghana. I think that for us, the issue of COVID expenditure has actually evolved over time. Initially, no one was backing up the call for accountability because we're still going through the vagaries of the pandemic, being a bit experimental with how we were tackling the pandemic. But now that we are set in our ways, we basically have an understanding of how to deal with it. We are getting vaccinated. The call for accountability is actually augmenting. And I think that if you look at it across the continent, this may be the case because several of the governments are implementing difficult fiscal strategies to try to rein in debt. As in the case of Ghana, we have a serious debt issue to where we are getting over 80% of our GDP being debt related. So it's a significant issue that's causing a fair amount of uprising among the youth, especially who are seeing accountability as a way to rebuild public trust. Without that accountability, they are not willing to budge on any new taxes or austerity measures that affect those in the lower brackets. So that's really interesting that rather than waning over time, the interest in accountability is actually growing because the nations, the governments are trying to implement fiscal measures to recover from the pandemic. Another important lesson for us is the fact that most of the response was actually centralized at the national level. Some of what we did was to go down into the local communities to see how much information people had at the local level, speak to religious leaders, speak to local assemblymen, to find out how much they are actually getting from the central government and how those funds are being dispersed. What we found out is that most of the intervention and, in fact, knowledge was at the central level, to where those in the provinces and the outer regions have little to no access to information. And that makes it very difficult. It just creates a divide that in the face of poverty and extreme and dire financial difficulty, people are asking, how can you account for this information? How can you account for these funds? If you're trying to raise new taxes, you need to first account for these funds before we agree to it. So that's a very interesting dynamic from Ghana. Thank you.
Yeah, thank you so much, Ray. Super interesting. And then finally, Sharon from Follow the Money in Malawi, if you're on the call with us, we'd love to hear from you. Very
Hi, everyone. Thanks so much for inviting me. So most of the things have already been said, but I just wanted to share something about Malawi. So we were very fortunate that when COVID hit, we got a lot of funding, and rumors started getting around that the government has started mismanaging funds and all that, but we do not have proof. So when the rumors got really strong, and that's when we also had the opportunity to get into CTAP phase 1. And we mobilized through the coalition building workshops that we had. We mobilized other civil society organizations and interested people to actually demand the government should do an audit of how they've spent the funds, or how the funds have been spent. So not just the funds, but also like all the material or donations that we got. And we pushed and pushed for that, and there was an audit. And in the audit, it was actually clear that the government had actually mismanaged most of the funds that were meant for the COVID relief. But strangely, the government did not do anything, even like with even when it was black and white that all the most of the funds had been mismanaged. So together with the partners that we had engaged during the coalition building workshops, we also we advocated, we wrote a petition to the president to actually do something about it, so that the people that had mismanaged the funds should actually be held accountable. And one of the success stories that I like to tell, and I think also Hamzi likes to tell about that one, is after our demands. And then that was also when we had just finished the report, the research that we had done during phase one. And one of the recommendations was that the government should actually be able, especially the president, should be able to sanction the people that had mismanaged the funds. And it was really great to see that our president, Reza Stagwera, actually fired the health minister, who was also implicated in the audit report, and he actually got some other people arrested. So for phase one, I think it was a success. But what we're looking forward to for the second phase is to actually work on the procurement itself, because up until now, we're not really able to get data. So one of the things that we're also advocating on, together with the partners that we recruited during phase one, is to actually work towards the procurement of not just COVID related stuff, but everything else in Malawi in general. Thank you so much.
Fantastic. Thank you so much, Sharon. Super rich conversation. Let's take a few questions all at once, just for the sake of time. I see there's one online.
Yeah.
We'll probably get out. And then I'll see if anyone in the room here has any questions as well.
Okay. If Frank's still with us, you're welcome to come on and ask it. But this one is from Frank Vogel from PTF. He is saying that they have several projects related to COVID in Uganda, Zambia, Ghana, and Argentina, and the challenge is how to scale them up to national levels. And specifically to maybe Renzo, has OGP or other funders basically support national citizen engagement when it comes to COVID healthcare monitoring?
Fantastic. So yeah, touching on like a global national link. I'll just take one or two other questions and then we'll do them in a round. Anyone in the room here with us in DC have a question for any of the speakers? Or it's fine if you're digesting your Nigerian jollof rice. Okay. Okay, good. So I see a few more coming in online. So again, let's take a question about kind of the global and local connections, and then should we try to grab one more online? Okay, great. We'll squeeze you in. Go ahead. Yeah.
Good question. The process. You see, like any efforts by the government to expedite what would normally be a longer process. They take advantage of that expedited process. Maybe
Yeah. So the speed kind of around procurement. Okay, and one more question.
I was wondering if some clustering issues such as gender are included in the cluster.
You said such as gender?
Yes.
Or other factors like social factors. Okay, perfect. Ian, why don't we start with you? If you want to just touch briefly on the question.
The speed. Yes. So for us, after this conversation, what I've done is to relate every of the talking points and written a longer write-up, because at the time we don't permit us to go through everything. So in the write-up you see, part of what we discovered was the speed was mismanaged, which was, for example, in the Ministry of Health, a single contractor was given almost all the projects, right? When you have almost just one contractor out and around, doing almost everything for the Ministry of Health, right? It's in there and how much it got to handle all the project. And you ask yourself, is this just this one contractor that could do all of these things? Why don't you have many more people to handle this process, right? And the response we got from the Ministry of Health when we asked the question was they qualified to do everything, but we felt that to get more competitive, competitive result, get more contractors to do that particular work. The name of the contractor is there, how much the bill is there. So please just people to check up after this conversation. Thank you very much.
Well, yeah, very good. How about Renzo and then Andie, if you want to chime in briefly on those questions.
Yeah, from our end, I would say on the funding question that at least from the research team, our latest analysis shows that it's one of the biggest impediments to actually completing the commitments. At the same time, OGP kind of is shepherding the process, so creating the rules, but at the local level, at the country level is when these commitments are actually either getting into plans or not based on the discussions there and the funding available there. So I'd be curious to know how our country colleagues, what they would have to say from that on this, in this event.
Okay. I can add that on some level, yes, funds tend to be a challenge, but one of the things at OCP we've tried to do is also support partners at a national level. Like we're working with DataFight on a small project, so we provide some level of microfunding, if you would call it that, and we're working on them to monitor healthcare procurement, and they're going to tell us a number of stories around that sort of information. So there's bits and pieces here, but definitely not sufficient to the demand that we're seeing around the need to monitor healthcare procurement.
I'll close it out here. Just the next 2 minutes. I want to finally just bring it back to Iyanuoluwa to talk a little bit about the future of CTAP. So again, the second phase of the project has just launched. What would be, one final idea that you want to leave us with today about how we can all support the efforts to make governments more accountable in their pandemic?
All right. So for us, we believe led actions. It's easy to take the forefront of all time because we believe that our own responsibility is to show you these things and to also point you to the right direction where we believe this message will be at. And we also, and part of the reason why we have coalition meetings with stakeholders and health sector in the government, in society, is to also bring a unified voice where we are all moving towards the same goal, which is to get the government to be more prepared, to get more investment into health, and to see how we can reduce vaccine hesitancy. We also want to see how we can make sure we have equity around vaccines. And also, we at the end of the day, we want to see, much more engagement between the citizens and the government as towards, healthcare accountability in Africa. So for us, for CTAP 2, want to see, if you pay attention to us and what we're doing, we are going to have a number of research work, and basically, those researchers will be touching on vaccine hesitancy. We're going to talk about vaccine equity, and also we're going to talk about healthcare investment. So basically, what we want to do is work to see how we can, encourage policymakers, right, to see these are the right steps we take, and this is not just based on just picking points from the side. We've done research on it, and these are the things we need to have together. These are the results we will see. And if we should have a pandemic like this in the near future, if all of these systems and policies are put in place, we should come out victorious at the continent. So for us, that would be what something to do like in this
Amazing. Thank you so much. Honestly, I'm just incredibly inspired by everyone we've heard from today. Really like on the absolute front lines of transparency and accountability work. I know CTAP is also, all about coalitions and partners. So everyone who has registered today, we will make sure to share contact details if people want to partner to support your next phase of work, especially looking at vaccine equity and hesitancy, as you said. And I also want to make a note that, Global Integrity has been serving as the learning partner for this coalition. So our colleague Jorge Flores, I know, has been online. He is also a great person to reach out to. And finally, we're really excited that BudgIT, who again has been a longtime partner, is now establishing its U.S. presence here as a member of our network. So we have Olusegun here in the room. I'm so grateful for all of the work that you and your team are now doing, because again, these are global issues. It's not just the challenge of African governments, it's a challenge of every government. So again, if you're interested in any of the collaborations, please get in touch and we'll be happy to connect you with people. And finally, we always try to end with 3 quick takeaways. There was so much rich discussion, but one takeaway I heard Again, it's all about collaborative approach. Civil society can be watchdog, but also real partners to fill the capacity gaps when government responds in an emergency. Number two, our role can be to simplify the data with real stories that mobilize citizens to act. And number three, we need to follow through and make sure that if there is real cases of mismanagement, like in Cameroon and Malawi, that there's follow through and there's sanctions, to ensure that people maintain trust in government when things go wrong. So there's so much, again, amazing learnings here today. I'm super grateful. Again, thank you, Iyanu, thank you, Renzo, Andie, thank you, all of our other CTAP partners who joined the Knowledge Cafe, and wish you a great rest of your day.